Yep.
Yeah. Okay. Hi, everyone. Nice to meet you all. I'm Olka. This is Samosh. We're going to be doing the clinical attachment section. Good morning, good afternoon, good night, wherever you guys are in the world. So yeah, let's start that if you want to go to the next slide. So if we start with what is the clinical attachment, it's an unpaid observership actually in an NHS hospital or a GP practice. I think most people do it in an NHS hospital. It's aimed at specifically international medical graduates as well as medical students and doctors who are seeking NHS experience. It's actually quite important for your CV or your NHS applications for work because they put quite a lot of weight onto, having experience in the NHS. The next slide, please. So what's its purpose? Um, Essentially, it's just familiarizing yourself with, the NHS system, the culture, how, it's quite patient centered care, teamwork, and there's quite a lot of difference between the cultural exposure in the NHS in the UK and especially where I studied from, probably where you guys worked from as well. You'll get exposure to clinical practice, seeing how multidisciplinary team works in the NHS. You'll be able to attend like MDT meetings, MDM meetings. It's also a way to demonstrate your commitment to UK practice as well. Like I said, you'll need some sort of NHS experience before you start working. And a lot of hospitals and trusts require clinical attachments to be done. There are also opportunities for networking and references. So when I did my attachment, I got quite a few references, UK references to be specific, which was quite useful in like job applications or anything else that I do because it holds quite a lot of weight compared to references back home or abroad wherever you studied. Next slide, please. So to secure an attachment, I have a feeling it was a lot easier in the past than it is now because I know, there's quite a lot of IMGs coming over, but it's not impossible. People that I know now have still, been able to secure an attachment recently as well. So the things that you can do is you can actually go on the different trust websites online and you can see, a list of contacts in whatever department you do want to do it in, like surgery, internal medicine, emergency department, and you can see maybe like consultants' emails. You can email them, write a nice email saying like why you want to do an attachment in their department, send your CV and any other information that would be appropriate. Another thing that you can do is I know quite a few people have gone on LinkedIn and searched up consultants in the specific departments that they do want to do it in, and they send them an email and they hear back from them saying, yes, you can do it and things like that. Another thing would be personal connections, which I know is quite difficult as well, but if you do have any personal connections, it would be good to use them to get an attachment. Another way is if you go to conferences or even webinars like this, there's quite a few. NDA do quite a few. I know some other organizations do quite a few as well. And like the one today, there's going to be Mr. Shah, Mr. Busnet, Mr. Shrestha, Dr. Hamal. They're all going to be available. You can email them if you want attachments. Obviously, they are quite busy, but hopefully they would get back and, offer you something if they can. Another way is you should apply quite early, I would say, especially if you're applying from abroad, as we are IMGs. It takes quite a lot of time, for the DBS checks, occupational health, any visas that are necessary as well. And I would say be open to different specialties, locations, and hospitals because limiting yourself will obviously limit the opportunities you get as well. So if you broaden that out all the way up to the north, all the way down to the south, there are a range of NHS trusts that you can go to that should have something available. Next on there. So for the general structure of how the attachment works, the duration's typically 4 to 8 weeks. However, it can go on for longer, or you can rotate in different specialties in the same trust. If you do, start in surgery, you get contacts to go to, for example, obs and gynae, orthopedics, A&E, things like that, just to rotate and see what each specialty is like. The setting is a hospital or GP practice, but personally, I would say you'd get a lot more out of your time in the hospital settings, specifically departments such as AMU, general surgery. You'll get a lot more opportunities to do things like QIPs, audits, and obviously, your role will be observational. It's not going to be hands-on clinical care, but you might get opportunities to go into the OT. You might get opportunities to do, some sort of clinical skills, even if it's like venipunctures, ABGs, things like that, just to get more experience. Your supervisor will most likely definitely be a consultant that you'll be under. They'll be guiding you throughout your whole attachment, giving you maybe projects or, you asking them to maybe read your CV, helping with things like that. Sometimes there can be a fee involved depending on how you go about it. But most of the time it's like around 100, 200, things like that. If you do go through contacts, maybe it might be cheaper, but yeah, bear that in mind that it can cost quite a bit, even like accommodation and things like that, that you can't get at the hospital. Next slide, please. So pre-attachment preparation, the documents that you will need are CV, list everything you've got, why you're interested, things like that. References from hospital, medical school, or any other jobs you've worked before. You'll need an occupational health clearance where they do things like immunization, TB checks, hepatitis, things like that. And you need to have a DBS check done, which does come at a fee as well. So bear that in mind as well. And obviously, visa costs as well. Personally, I did not need a visa, so I'm not too sure on that one, but I'm sure Chitij or Abhishek can answer your questions if you have any questions on visas. It'll be good to read up on, the hospital, the specialty you're doing it in, the department. There'll be quite a lot of information on the actual trust or the hospital's website that you can go through, and obviously, keeping up on the knowledge, things like that. Another thing I would say for pre-attachment preparation, which is quite important, is set your learning targets and goals that you want to achieve over the 4 to 8 week time period. And as you go, you can, keep a check list and just tick it off as you go. Like, for example, like Natasha and Mateo were talking about the IMT applications and what you need. You can start off early, which will be really good. And another thing is at the start of your attachment, like for my attachment personally, when I first came in, my consultant asked me, what are your goals? What do you want to achieve? So it's important to have them written down and noted so you look prepared as well. Next slide, please. I think it's handed over to you now.
So I'll be covering what to expect day to day on an attachment. So I think it's important to immerse yourself in that team, the department that you've chosen. Once you get secure an attachment, just think of yourself as a part of the team. So you'll be attending the handovers, the ward rounds, clinics. Sometimes you can get an opportunity if you're under a surgical department, you can get opportunities to not scrub in, but you can observe a lot of surgeries as well. You can attend the annual MDT multidisciplinary meetings, and there'll be a lot of good knowledge that comes out of that, a lot of case discussions about patients and the senior members. So on the day-to-day, you can expect to observe patient interactions. You can do some history taking, examinations. So this is a learning opportunity for you to kind of see how the patients present in the NHS system and how different like the culture is and how different their problems and their worries are compared to wherever you're based. Another thing to expect on a day-to-day, you can expect to learn the electronic system. So a lot of hospitals here are electronic. So if you're used to, like, paper documentation, this will be very different and a new thing for most of us. So electronic systems is the norm here. So it was very important to be kind of IT competent, and to be able to use the softwares that the hospital uses. So things as prescribing, doing discharge summaries for patients, making referrals to different specialties, and ordering investigations, imagings, and things like that. So you can also expect to attend teaching sessions. So most specialties, most departments will hold monthly teaching sessions where you can even get opportunities to deliver your own sessions if you're proactive. And if you ask, there's always like a teaching lead within the junior doctors. So if you contact them and you show your interest that you want to teach, then it will be a very good opportunity for you to teach as well as learn a lot of different subjects that will be covered in the teaching sessions. Again, you can expect not much limited, but you can have some direct patient contact through history taking, examination. So that's also something to expect. Like Alka said, I think it's very important to keep goals, set standards for yourself, and keep a reflective journal. So what you do on a day-to-day basis. So just keep a log of what you do, so you can reflect, go back on what you did, what you could improve on. I think it's very important as a doctor, especially in the NHS, as a reflection, to be a reflective doctor, to kind of look back on what you've done and build up upon it. So another thing you can do, if you've done any teaching, any participation, you can collect evidence over that attachment period. So you can get certificates from the teaching med-ed centers. If you've done any teaching, if you've done any participation, you can also get a certificate of participation in different teachings. As Alka said, I think your consultant will be your main guide throughout your attachment. So you can ask them as many questions as you would like, and they'll be happy to answer, working on your CV. If they've observed you interact with a patient, they can give you feedback on, what you can improve on, your clinical and your medical knowledge, as well as the patient interaction. So opportunity to present cases or topics. So, you should take your chance to, in handovers, if you've seen a patient during an on-call with the on-call team, it's very good to kind of present that case in the handover, so you kind of get a feel of what the handovers are like, what are the key important things that you need to cover, and what are some unnecessary data, things that you don't need to mention. So we need the handover to be concise and very detailed at the same time. So you'll get the hang of like what is required in a handover about the patient. And it's very important, I think, as an attachee, is a great platform to take part in QIP, so quality improvement projects and audits. These are something that's very highly valued by the NHS and the job application and training requirements. So, be proactive, ask around in the department, junior doctors, registrars, anyone that if they have any ideas for a QIP or an audit, try and be the lead, or even take part in an audit. So, once you complete the cycle, you can get a certificate from that aspect as well. So, apart from all of that, I think attachment is also a very good opportunity to build connection. So, engage with your supervisor, your consultants, and all the different consultants in that department, and all the junior doctors. You never know, an opportunity might come your way. So maintain a good rapport. And attend the departmental teachings. So sometimes there's interdepartmental teachings as well, where you can meet consultants from different departments, doctors from different departments, and always keep like a good rapport with them as well. And all of these consultants that you meet, all of the doctors that you can meet, you can always ask them for tips on NHS job applications. Many of the seniors in the hospital will be involved in education and recruitment. So they'll have very good idea of what is expected of a candidate, and they can give you very valuable information from that regard. And once you've got a good rapport with a lot of consultants, they'll be more than happy to give you a reference, given that they've seen you work and your personality. They can give you a character reference as well as a work reference. So some of the challenges you may face as an attachee, there will be limited patient contact. You won't be leading the ward round as per se, so you'll be kind of observing. So I think it's important to focus on reflection, learning the systems like the IT softwares and all the different techs that we use, and maximizing your portfolio. So within your 4 to 6 weeks, kind of focus on maximizing your portfolio more than anything. And there's also a challenge that I would say would be adapting to the terminology and acronyms. There's a lot of different acronyms that we use in the NHS, which when you come from abroad, when you come to the NHS for the first time and you hear it, it can be very confusing. So it's a good thing to look it up beforehand, short acronyms that we use, because that can be very confusing. But never be like daunted to ask for help, and there's never a silly question. So if you don't know something, just ask, and then the junior doctors especially, will be more than willing to help you. They're all very helpful, that I find, during my attachment. So another thing I think you'll feel as an attachee is you feel very passive, and you feel like you're kind of in the way of people doing their work, because you come in and you're observing, and you're not like you don't feel as a part of the team. Sometimes that can be a feeling that you can get, but I think that's something that's kind of I think that can be easily overcome. You can talk to the doctors, be very like friendly with them, and I think it's also important to note that these doctors are actually doing their job. So sometimes they might just be very busy, because the junior doctors are usually the ones carrying out a lot of jobs after the ward round. So they'll be very immersed in their jobs. So it might feel like, they're not giving you time, but it might just be that they're very busy and overwhelmed themselves. So always offer to, if they have any jobs that you can help with, if there's any documentations you can do. Sometimes the junior doctors are more than happy, and they welcome attachees helping them out with their jobs in the ward rounds. So to summarize, I think the benefits of the clinical attachments, you can have academic benefits, so you can, there's a lot of learning opportunities as well as teaching opportunities. So there's a benefit in career, so you can, there's a lot of opportunities to network, meet new doctors, meet new consultants, and even find out if there's any job vacancies, and references, as well as look for future opportunities. And also it gives you a very personal benefit as well. So give you confidence after familiarizing with the NHS system. It will give you a lot more confidence to be in that environment, and it will give you, it's a very versatile field. So you'll have to be adaptable, and doing an attachment, I think it will expose you to that different challenges, and you'll become very adaptable as well. So I think the tips for success that I'll give you at the end for an attachment is to be very proactive, seek out opportunities. They will not be handed to you. They will not be handed to you. So always ask for audits. Always ask to do teaching. Just show very enthusiasm, and always be professional. Don't come up late and looking unkempt. So always act like you already are a doctor. So just pretend, not pretend, sorry. So you have to present yourself as a doctor and show professionalism, be punctual, take every learning opportunity you can get, attend all the teaching, or attend all the interdisciplinary MDT meetings, and try and network as much as you can, meet as many doctors as you can, and build a good rapport. And you can use this attachment. By the end of the attachment, the consultants sometimes are more than happy to give you a little letter saying that you've done this attachment for this period of time and you've showcased your abilities. So that's also another thing you can do. Thank you, guys. And if you have any questions, feel free to ask.
Thank you very much, Alka and Samosh. That was really informative. I think we have a few questions in the chat. One of them is, what would be the approximate cost for a clinical attachment, roughly a round figure?
It depends on the hospital. I've seen a lot of hospitals actually that I personally didn't have to pay for my attachment. There's a lot of consultants who are willing to give you an attachment. You just have to keep on trying many different consultants through LinkedIn, like all the different tips that Alka gave. Just find as many consultants as you can. But I think I've seen some hospitals go from around, like Alka said, around 200 to ranging up to £500. So it can be quite pricey. But I think before you settle for that, I think it's good to kind of just reach out to as many avenues as you can and reach as many consultants as you can. And I don't think if you have to pay, then you have to pay. But like, I think you can easily as well secure an attachment without having to pay. The only additional cost would probably be travel and accommodation and things like that. But the attachment itself, there's a lot of consultants that will give it to you for free. Yeah. But I have seen some hospitals that charge up to £500 for an attachment. So it depends. Yeah.
Wow, £500.
Mm, mm.
I think you have to choose very carefully where you want to go. And you have to take into account your accommodation cost, your travel cost. That's really important. And the cost for your DBS check. But as far as I understand, most of the hospital in UK doesn't charge money for the clinical attachment, but some of them do. If they do, then they might have slightly more structured program. Taking any clinical attachee in the hospital is voluntary work, and I think it's the consultant that who take them are doing for the goodwill of the other people. Okay.
Yeah, like Asta Karki says, occupational health clearance can also be costly. Yeah, that's also another thing to look at. So vaccinations for Hep B,